So, Kevin, it's really good to catch up with you quickly. I was delighted to see the release of Carbex's new Stewardship and Access Plan Development Guide. Talk to me a little bit about that. How did that get started?
When you think about stewardship and access or innovation, Carbex is an innovation-focused organization. Uh, Thinking about that over the years, I realized that these are really interconnected. There's organizations that focus on just one of those three. If somebody might be access-oriented, and if you carry that to its logical conclusion, you might give free antibiotics to everyone in the world. That would maximize access. But what would that do to stewardship? To have free antibiotics to the world. And also, what would it do to innovation? If the companies have trouble making money today, imagine if the antibiotics were free to the world. So it became clear that we should do all three of these things together, that even two out of the three wasn't sufficient. And so Carbex, even though it was predominantly an innovation-focused organization, from the beginning, everyone who's ever received money from Carbex has contractually agreed to these stewardship and access principles, which are described in the development guide, which is now being released.
Yeah, I recall seeing that as we kicked Carbex into gear, and there were a lot of questions at the time about how do you do this, and there was this interesting line at the beginning of the SAP development guide talking about the fact that the developers were coming to you asking for this. Tell me a little bit more about that.
But one thing to know is that this isn't really a one-size-fits-all sort of approach. We're not trying to tell the companies what things should look like. We're also very understanding that most of the Carbex companies have about 10 employees, and they're preclinical.
Yeah.
So our guidelines only kick in when they're in phase 3 pivotal trials. It doesn't go public until they have an approved product. So we're trying to recognize, to be realistic with these small preclinical companies. But the thought is that instead of trying to tell them what to do, let's help them do something that's practical and useful. And so that's what the core of the requirements in our contract require. It's also what we describe in this development guide, which I should say clearly it's for Carbex supported companies, but it's really broader than that. The authors, the people that worked on this were the U.S. government, BARDA, HHS, the Wellcome Trust taking a very important role, and many others as well.
Access to medicine, right?
Yeah. Access to medicine, GARDP, because we knew that what we wanted was something that was practical and helpful to the companies, and hopefully that's what we've achieved.
Yeah, I was fascinated to see the list of both questions to ask yourself, and there's a long list of ideas for things that you might be able to do. And I was just fascinated to think about that list and how it came about. And is there anything you've learned by putting this together? I'm sure there'll be lots that we learn as people apply this, but what are the sort of the early insights you've got about the struggles companies have had and how maybe this development guide will help them?
I think one thing that's important to note is that even today's antibiotics, largely brought to market by larger companies than the ones that Carbex works with, they have struggled to have anything approaching global access through really very little fault of their own. The last 18 antibiotics, everything approved by the FDA since January 1 of 2010, so a decade of innovation. Can you guess how many are commercially launched in Canada as of today? The answer is 2.
2.
Yeah. So if 2 out of the 18 are launched in Canada, which is a high-income country, imagine the difficulty of getting a lot of these drugs actually utilized around the world. And so there's a bigger problem here that deals with the way that we pay for antibiotics globally. But certainly we wanted the companies to be able to begin to piece together the solutions that they could put their hands around and to find the partners, the other organizations, as described in the guide, who might want to help them.
Right, and that was something that really did strike me as I looked at those list of ideas. A fair number of them, I could look and say, that's an interesting idea, but the company can't actually do that. The company can encourage it. The company can create the conditions where it would be possible. But the actual implementation of a fair bit of the tools around stewardship and access depends on other people. And I thought, well, that's interesting. And so maybe I think it does seem you have the idea that this will be a set of benchmark for companies around the world, not just from CarbX, about what the companies can do. And are you thinking about doing stuff to roll this out to companies, but also to the rest of the ecosystem? There are other partners who have their part to do as well.
You had about 5 questions
Yeah.
rolled in there, but without a doubt, this is for really the entire R&D ecosystem. It's really for everyone to take a look at this and see if it's useful to them. I would be pleased beyond all measure if companies that had no contractual obligation to utilize this guide decided that it was a good idea to utilize it. That would be wonderful. And certainly, I mean, think about stewardship. Stewardship in the United States is predominantly in the hands of the CDC and lots of hospital stewardship programs that are supported directly or indirectly by the U.S. Department of Health and Human Services. That's government. We can ask the companies not to do things that actively fights against stewardship and to support the things that are going on within CDC and HHS. But, that's a good example of, who are the other partners that have a fair amount to do, multiply that across every country in the world. On access, think about plasmamycin. I'm told that for Cipla, the actual price of the plasmamycin FDA-approved drug was not the full price because they took other things. It was really about $4 or $5 million. Okay, so imagine that you just gave away for free the IP to a dozen recently approved antibiotics to anyone who would take them and try to make it accessible to the 120, 140 poorest countries of the world. Okay. Cipla today still hasn't rolled out that drug, in all sorts of places around the world. I think it's only licensed or launched in the United States at this point. I don't think it's even launched in India, their home country. So even if the companies gave the IP away for free for the poorest countries of the world, you still need someone to pay for the manufacturing plant and the whole 9 yards. So I don't know what the right solution there is, but it obviously requires other partners in addition to, together with the companies. It has to be a partnership, or else I don't know that we can make meaningful progress here.
Yeah, it really is something you have to do step by step in every territory around the world to make it available. And you can only do so much so fast. And, times we've mused on the idea of whether there's some sort of a global contract for making antimicrobials available in a more rational fashion. That's still some ways off. And so, I guess that's the basis of the math that says you need $350 million or so just to break even over 10 years, even if I just give you a drug for free. Well, fabulous. I mean, I don't want to take too much of your time today, and I really appreciate the opportunity to share the story a little bit. Is there a rollout coming? Some webinars or something?
CarbX will have a webinar focused predominantly on our product developers, on people who we find and therefore have this contractual obligation. We probably will do something broader for the broader community as well, to continue to give people the ability to understand what's happening. And as we gain more experience, I think this is something that we'll learn as we go. Right? This is a learning process, not the end destination for stewardship and access for antibiotics.
Yeah, and sort of a tangential question: what do we know about Pasteur these days in the U.S.? Where are we with it?
Well, if you follow the COVID relief legislation that just came through the House and Senate, a major piece of that was a child tax credit, which is being credited now as as something that will dramatically reduce child poverty in the United States. Primary sponsor of that chunk of the law was Senator Bennett, which and everybody else in the House and Senate have been very busy in these sorts of COVID pandemic preparedness things. So AMR and Pasteur did not have the front seat in the first 60 days of the Biden administration. I think it's very, very hopeful that as we're getting closer to the 100 days, that we'll see newly reintroduced Pasteur Act in both the Senate and the House with the same co-sponsors, with ever so tiny tweaks to it. People have noticed a nit or two, but essentially the way that people have seen it before. And I think there's a lot of support for this, as long as we can move on from the necessary and understandable focus on COVID to thinking about this slower bacterial pandemic that you've been working to try to prevent for many years now.
Yeah. Well, thanks for that quick update. Just fun to know because you're so close to what's going on there. So again, say hats off to you guys at the Carbex team and all your partners. Just fantastic to see this. None of us are safe until we're all safe. We need the drugs available, and I think this is a marvelous step forward. It's really going to be one of those benchmark tools for a long, long time. So thanks again for making time to chat with me today, and stay safe.
I just need to find a fireplace so that I can keep up with your backdrop there.
Well, it was great to have Kevin on today. It's just fantastic work by the Carbex team. Read the newsletter for more of the details, read the SAP development guide itself, and like, comment, and subscribe for more. Stay safe.